Welcome everyone. Welcome to the Bridge Builders of Diversity. Today we're going to be talking about spina bifida in early intervention.
That's right.
Well,
because we have to look at our nerves.
For the definition.
Well, spina bifida is a condition that affects the spine, and it's usually apparent at birth. So it's part of the spinal cord that doesn't get covered, essentially, by the spinal canal, and that can affect, depending on where in the spinal cord it's uncovered. Right. It's especially dangerous if the baby is born without that detected, and it can cause paralyzation and things like that. So, while the woman is pregnant, they'll do ultrasounds, they'll do things to detect that, and they can do surgical procedures to help cover back or put a patch in to prevent worsening defect.
Right, it's really not as life-threatening as it used to be because of advances in medical technology. And detection. I think the number one is detection. If you are fortunate enough to have good prenatal care, normally you would be going through is a blood test to look for the alpha fetoproteins. Anyone who's had a baby knows this blood test, and then you would eventually go for an ultrasound, and an amniocentesis can also detect a neurotube defect. Yeah, they call it a neurotube defect, which is basically the tube around the spinal cord has some kind of hole or like a missing part.
Right. Well, that's what it needs a patch, essentially.
Right. Sometimes the spina bifida isn't detected until the baby's born, and there's actually a form of spina bifida that you can go your whole life and not know that you have it because it's not very impactful. It's called Spina Bifida occulta. I kind of like the name occulta because it's in the shadows. You don't know it's there, and many people go their whole lives, or maybe in their adulthood they'll have back pain and discover it. Did you want to talk more about diagnosis, or?
No, I mean basically it's early. It's early detection. And then
keeping your prenatal appointments, going to the OBGYN.
Make sure you keep up with your appointments and
take your vitamins. Get that folic acid.
As healthy as you can possibly be for good formation of that baby.
Yeah.
Right, and again, this is definitely a spectrum. Like Kim said, depending on where the hole is in the spinal column, it can be very impactful with mobility impacts, or it can be only slightly impactful. In other words, you don't even know that you know. But either way, you really want to get your child into early intervention as soon as possible.
Absolutely.
And one of the things that I think that I want to make as clear as possible to people is that you don't need a doctor's referral. A lot of times a pediatrician is seeing your baby for 10 to 15 minutes at a moment in time. They're probably scared. They're probably crying or sleeping, and they're not getting a really clear picture. So as a parent, you're the front line there. You notice that your child isn't meeting milestones. And the CDC, I'm going to make sure that this is in the comments, has a Milestone Tracker App. So if you have any concerns at all about your baby's development, you can check on this app to see, my child is 12 months old, and this is a list of things that they should be doing. And that way you can be that early intervention screener. All you have to do is call. The CDC has a link to every state's early intervention. You just call them, you say, I don't think my child is meeting their milestones and I want to have them evaluated. You have to do that before they're age 3. After age 3, it becomes the school district's responsibility. So if your child is 3, you call the school district, and if they're under 3, you call the early intervention, or sometimes it's called birth to 3. It has a lot of different names, but if you go to the CDC's list and check on your state, they'll link you to somebody in your area that can do a birth to 3 evaluation or early intervention evaluation for your child.
And early intervention is wonderful. My son went through early intervention, not for spina bifida, but he has Down syndrome. So people would come to our house, they would work with him, make sure he was meeting his developmental milestones, which is very important to brain development as well.
Absolutely. And that's one of the things that spina bifida can impact is mobility, and mobility impacts learning, but you wouldn't think that, would you? Like that, but a child's ability to move and explore their environment, just getting the crawling motion helps stimulate brain development. So you really, really want, and I make this motion because it's so good for your brain, even when you're a grown-up.
Yes, it is that cross.
Moving your body is good for you no matter what, but for a child it's essential. So if a child does have a mobility issue, if they're very static and they don't like to move, contact your pediatrician, and then if your pediatrician doesn't respond, then again, I'm not slamming pediatricians because they really just see the child in a moment in time. Call your early intervention provider.
And as a parent, you have every right to advocate for your child, so don't be afraid to speak up. Always be
Absolutely.
Cool, calm, and collected, and voice your opinions and
right. And the Milestone Tracker would really help, because you would be able to say, oh, my child is this age and they are not doing this.
Right.
I'm going to give an example. My child is a 1-year-old and they're not crawling. That's definitely something that, like, and it's funny when I meet babies, I find myself going through a checklist. So, are they crawling? Let me see. Are your reflexes good? Are you moving?
Tripod?
Are they sitting? Right.
Mm-hmm.
You just do those things because I'm an early intervention and preschool teacher. I just do those things automatically when I meet a child. It's not so inherent for parents because we love our children so much, and we delight in everything that they do. But check the Milestone Tracker app. You might find that your child is advanced.
Right. And a first-time parent may not know what the milestones are.
Right. Especially if you don't have a lot of other children around you. You're far away from family.
Right. Like, I'm the youngest out of both sides of my family, the youngest of my siblings. So when I had children, thankfully my oldest son was very healthy and did everything on time. And then his brother was born with Down syndrome, so I had something to compare.
Right, he had older cousins that you could say, oh yeah, I remember when they were this age, they were doing these things.
Right.
So you knew that he was right on track. Not everybody has that luxury or that comfort. So.
Yes. But it's important to make sure your child is meeting those milestones and get out there and advocate for them. Don't be afraid to speak up or talk to a teacher, talk to the pediatrician.
Right, because if you can't prevent Spina Bifida or another birth defect, you can definitely remediate it.
Yes, absolutely.
It doesn't have to be the end of the world.
No, it doesn't.
If you like our content, don't forget to like, share, and subscribe to our channel. Smash the button.
Bridge builders of diversity. We're building bridges of knowledge and understanding, and
for the special needs community.
Absolutely, we would love to hear from you. If there's anything that you want to hear more about, do you want to know more about early intervention? Do you want to know more about Spina Bifida detection? Just let us know in the comments.
Anything.
Absolutely, we would love to do the research for you. And get that information out to you and build those bridges.
Yes, absolutely. So don't forget to subscribe to our channel, hit the bell notification so you'll get our...
We forgot to introduce each other.
Oh, yeah, absolutely. I'm Sherry. I'm a parent of a child with Down syndrome. This is...
Kim Lima. I am a nurse.
And
I'm Roberta Curry, and I am a special education teacher. And together we're Bridge Builders of Diversity. Thank you so much for your time.
Guys.
Don't forget to like, share, and subscribe.
Thank you, guys. Appreciate you.
Bye.
Bye.